Okay, guys, hello and welcome to my first session on going through interview questions. So today the main aims are to go through some practice questions that I've set out for you, and we're going to sort of like make like a rough general plan or like the top tips that I'd say you need to hit when you're trying to answer these styles of questions. And I'll either go through like a model answer myself or we'll build an answer together throughout the session. So let us just get started on that. So I'm going to share my screen. So tell me once you can see the screen where it will say like question 1, a patient with severe anxiety at the top. If you can see that, let me know. Yep, you can see that. Perfect. Good. Okay, so question to the floor. This question is an interesting one because it hits on a few points. It hits on the idea of severe anxiety and like management of patients that are kind of like afraid, or they have like phobia, like they have dental anxiety basically. So if I'm going to open this up to the floor, what do you think are the key things that we need to think about when it comes to this style of question? What are the key points that jump out at you with regards to a question about anxiety and dealing with a anxious patient? So you can either unmute an answer or type it in the chat, whichever is easier. Empathy. Yep, that's right. Empathy is important, definitely.
Could get the nurse involved.
Could get the nurse involved. Yep. Cool. So why would you want to get the nurse involved? What things would be good with regards to getting a nurse involved in this situation?
Okay, sometimes patients find it more comfortable to talk to nurses because they're less intimidated by them.
Yep.
So they could probably explain it to them instead and it could calm them down.
Good. Nice. And Fatma's just said refer them to therapy like CBT. Can you tell me a bit about CBT, please? Because that is a good point to mention.
Like they'll be exposed to like drilling, like just looking at drills first, and then maybe just a picture, and like slowly step by step they'll be introduced to like drilling, and then they'll know like it's not that scary. It'll be a step by step process.
Yeah. So cognitive behavioral therapy, like it transverses quite a few things. So a lot of people are quite fixated on it just being a treatment for like dental anxiety, but it can actually use just for people that have anxiety, like towards other things, or can also be like a type of treatment for depression. So yeah, it's really good to mention CBT because one thing that I feel like people fail to do in ethical scenarios is they go through the whole process, they talk about the ethical principles, they talk about how to manage the patient, but sometimes they forget to give me like a overall solution. So as a result of this, yeah, you've told me that you need to take into account the autonomy, get consent, etc., etc. But have you actually told me what you're going to do to help the patient in the long run? And with CBT, it actually gives the interviewer information as, yep, so I'm going to do this. I'm going to take into account all these values, all these ethics, etc., but I'm also going to give you a final solution, which is something like CBT. So yeah, that's good. Well done on that. Someone else said, Disha said, ask about the cause of the anxiety and manage these concerns. Good. Yeah. So how would you do this, Disha? How would you find out more about their anxiety? What would you do? If you're here. I can see you're unmuted, but I can't hear you. So okay, cool, that's fine. So I'm just going to mute you, Disha, because I can hear myself on your screen. So Mohammed Aziz says, explore their ideas, concerns, and expectations. Good, nice. So why do you think it's important to find out their expectations? This is specific to Mohammed Aziz, the person that stated that. Why do you think it's important to find out expectations?
I think it's important to know what they actually want, that, the treatment they want at the end of this, what's the outcome from this.
Yep. That's good.
And I think by knowing this, it might sort of alleviate the anxiety. I'm not sure, but it could help.
It could, exactly. So, I don't know why this is doing this. The thing when it comes to dealing with anxiety is that also can you just mute yourself? So yeah, just the thing is with anxiety, you have to make the understanding that you have to be realistic. So you're not going to treat their anxiety today. It's not like they're going to come into your practice and suddenly after you show like your empathy skills and you might be like the most empathetic person in the world. You're not going to suddenly treat their anxiety. That's not realistic. But a realistic outcome is to find out what things is the patient expecting from this treatment, what things are they scared about, what things, what are their like the misconceptions they may have. Because a lot of patients come in thinking, oh God, if he's going to use the drill, he's going to cut into my teeth, or she's going to cut into my teeth, and like it's going to be really painful. And if you just explain to the patient, you know what, no, this treatment is going to be painful or isn't, or we can do this or that, it can actually help quell some of the fears that they may have, and it can make the treatment go along a lot smoother. So yeah, it's good to explore their idea. I don't know why this is doing this. Yeah, so it's good to explore ideas, concerns, and expectations. Good. Lovely. What other things do you think we can mention? So what is like the first thing you need to do when a patient comes into your practice? And just building up from this, so Disha said bring someone in for support. Okay, so let's say, and well said, you said in the pre-COVID world. So what other things could you potentially do if they can't bring a family member physically in? What other things can you do to have that family member, to have like a family member there? Video, good, exactly, nice. So there you go, guys. That's a way that you can kind of make your answers a bit more unique. So what a lot of people do is they kind of like rehearse these answers and they're just like, yep, bring a family member in. But what if the interviewer says something like, well, we're in a COVID-19 world now, everything's changed, how can you change this? Having a solution to that can really help give a different dimension to your answer. So saying something like, as Disha said, have them on a video call, or ask them if they want to like have them on FaceTime near you while you're doing the procedure, etc., can really make your answer stand out a bit more. So that's good. Raheem said music. Yep, music's also very good. Music's a very easy thing to integrate because you can a lot of practices have music in the background anyway, to help calm down the patients. And anything else? What else do you guys think we can mention here?
Can you not like demonstrate the procedure, like show and tell?
There you go. Cool. So it's called the tell, show. Yeah, tell, show, do. Had to double check that technique. Does anyone know what the tell, show, do technique is? Yes, no, maybe? Cool. So quite simply, but with the tell, show, do technique, what you're doing is breaking down the treatment before you do the treatment, or you're breaking down the instruments you're going to use before you do anything. So with the tell, you're just telling the patient, like, okay, we're going to use this instrument, this is what we're going to do, etc., etc. Show, you might then take the instrument out and like show them the technique or show them what you're going to do. So let's say you want to show like a child how to brush their teeth properly. First, you tell them brushing your teeth is this. You put toothpaste on, blah blah blah. Next thing is you might get the toothbrush and show them on like a model. So you'd show them how to brush their teeth. And lastly is the do. So you then either tell them to do it like in their own time or do the procedure that you're going to do in the practice. So hope that makes sense. That's a really, 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 really easy thing to mention in your interviews. And it shows that you have like, again, that's another example of like giving a solution to the problem you have instead of just trying to like work through an answer. It's always good to just give the interviewer a solution, because at the end of the day, they are looking for the ability for you to think and the ability for you to break down the situation, but they also want you to fix the problem. So yeah, so tell, show, do technique is brilliant. Nice. And just a few more things that I'd mention here. When it comes to any ethical scenario with patients, I always love to introduce informed consent. So before you do anything, so before you do anything or before you continue treatment or whatever, always ensure that you make it clear to the interviewer that whatever you do has to come with the consent of the patient. So let's say you've told the patient all the risks and benefits of doing the treatment and they still don't want to do it. That means you don't do the treatment. So it's up to the patient in the end, and for you to actually get treatment done, you have to get their informed consent. That also falls under like the medical ethic principle of autonomy. One more thing that you guys haven't mentioned as well is you need to talk about the benefits and the risks of the treatment that you're going to do, or talk about the benefits of the risks of not doing said treatment. Does that make sense? Let's see. Yep, no. So I'll go through it really quickly. So let's say you need the drill to, I don't know, prepare like an access cavity prepare like access for you as a dentist to remove caries. Okay. If you don't do that, what will happen? The caries will stay in the tooth, or the caries will just stay there, and the caries will progress further, and you could potentially get something like a pulp infection. If you get a pulp infection, the pulp starts to die, you might need a root canal treatment, or you might need to extract the tooth, which is obviously something the patient doesn't want. However, what the patient's thinking of here when they're anxious is, I just don't want the tooth to be drilled, but they don't know what the risks are of not having the procedure done. So another important thing we need to do, which I'll add here, is need to assess and state the risks and benefits of doing the treatment / not doing the treatment. Cool. Does that make sense? Just type in the chat. Yep, good. So yeah, that's one thing I always say when it comes to any type of treatment that you need to do. Even if the patient does say yes, even if they say yes, that should come as a result of you. That should come, sorry, after the fact of you saying the risks and benefits of treatment. That's how you gain informed consent. Informed consent includes the point of informed consent is that you're ensuring that the patient makes an informed decision. So they understand what they're doing. They understand the treatment that's about to occur. Doesn't mean they need to go into like the scientific specifics about, oh, did you know that this bacteria causes this and this? But it's more understanding, okay, well, if you do this, this is what's going to happen potentially. And I want to do this treatment because of this. There's also these alternatives. So that's one more thing. And leading on from that, you can mention any alternatives. Treatments. You can get a second opinion. So one thing I always like to mention is, if you're stuck in like with regards to an ethical question with patients, it's always a good idea to get a second opinion. So you can always say, look, like the patient might not, it's not they might not trust you, but they might just want someone else to say the same thing, so they feel a bit more comfortable making a big decision, like with regards to like something that they're afraid of. So getting a second opinion is always great. And what else can we mention here? And yeah, that's kind of like, I'm sure there's more things to mention, but as I said, these are some of the main things I'd say, especially in a question that's going to be like 5 minutes long. Oh, last thing. So here's a good question for you guys. What is one of the most common reasons people come to the dentist for? Like, what is a really common reason for people to go to the dentist?
Preventative care.
Okay, what else?
Get rid of pain.
Good, pain, right? So we need to also establish if this person's in pain, correct? Because think of it like this. Let's say this patient's come in, they have a toothache, then you're like, okay, I'm going to fix this. Let me just get the drill in, like to help, or like to get a particular procedure done. But then they say no. Does that, and let's say after you've tried to convince them or you've tried to explain the procedures, they still say no, and obviously you have to respect their decision because of autonomy. Does that mean that you just send the patient home, or what would you do? If a patient was in pain and they did not want to do treatment, what could you do?
You told them the risks of not doing the treatment.
Yep. But specifically if they're in pain, yeah, what exactly? So managing the pain. So how can they manage the pain? What thing? Yep, there you go. So painkillers. So you can prescribe things, prescribe something to deal with the pain. Do you see how that's now providing a solution? I know I keep saying this idea of a solution, but it's so many people get to do this in their answers because they're just so focused on like trying to sound smart by saying, oh yeah, I know about autonomy, I know about non-maleficence, I know about beneficence. That is important 100%, but it's more about building up an argument for you to say, okay, well, I'm going to take these things into consideration in order for me to decide a solution for the problem. So that's the main aim, is to ensure that with the argument you make, you come to a solution in the end.
But is that more of like a temporary solution?
Sorry. Oh, is this more? Yeah, this is more of a temporary. Yeah, definitely. It's not a long-term thing. So good. So you mentioned that. So what can you then do? So you've prescribed them painkillers, but you know as a dentist that the disease is going to progress. What can you then do? What other thing can you do to ensure that treatment is done in the future? So let's say on that day, that patient does not want to be treated. What is an alternative? What can you do?
You could like rebook the appointment, maybe.
Good. Nice. There you go. So reassess at future appointment. What's another thing you can do? Now this one, I want to see if one of you gets this. So let's say you say you want to book them in for another appointment at your practice and they say no. What else can you potentially do?
Could you send them to different dentists?
Sorry, say that again.
Can you refer them to a different dentist?
Good. There you go. Yep. Refer to a different dentist or a specialist. So maybe their treatment needs someone that's more specialized in this field. There's also specific care. There are some dental centers or dental practices that specialize in dealing with more anxious patients, so they factor in more time to help deal with those patients. They go through things a bit slower, and you have to understand that this also shows some relevance and understanding of like how NHS dentistry works, because in NHS dentistry it is quite fast paced, and not every patient has that. Like dentists have a lot of dentists are quite rushed and quite stressed, so they might not have as much time to deal with an anxious patient as they would like. So it could be a good idea to refer them to another specialist or a dentist or like a special care practice, like a special care practice that helps to deal with anxious patients. Cool. And someone said call them. Yeah, you can call them. Yeah, so that's like triaging. But the issue with that is they will still be in pain. So we do want to try and find a solution. So calling them is correct, but we want to find something that's actually going to be like a physical solution. So something that's going to be like long term, because obviously just prescribing them painkillers is just like it's treating the symptoms, but it's not actually like curing the disease or dealing with the disease that they have in their mouth. Just remember that. So yeah, it's not like a long term thing. And obviously we don't want this patient to be in pain their whole life. So we want to get things done. Cool.
You know, when you mentioned the like rebooking the appointment, is that like the last resort?
It's not really a last resort. It's just
Okay.
an option that's there. So here's the thing: you have to understand that sometimes the patient might just not be ready to have the treatment on the day. Like if they are anxious, if they're worried, they might not want to do the treatment then. And just giving them a bit of time to think or a bit of time to like process and get ready for the treatment might help them out more. Because bear in mind, if let's say the patients come in and they've got toothache, they're not sure of what you're going to do to treat them. They don't know if you need to use a drill. They don't know if it's something really simple like that you just need to do like a bit of polishing and scaling. They don't know. So maybe once you've shown them the treatment and you've explained it to them, they need to go back home, think about it, and come back in the future. But yeah, no, it's not a last resort. But you should be. But in counter that, you would say you do want to try and treat them on the day, if you can, because it's our job to provide the best patient care, and we strive to get treatment done as quickly as we can in order to like aid the patient's ailments and problems basically. So but yeah, don't think of it as a last resort. I see where you're coming from in terms of you do want to try and get it done on the day, but if the patient doesn't want to do it on the day, well, the patient doesn't want to do it on the day. You can't force them. So yeah, so that's like the principle of autonomy again that you can mention in your answer. Cool. So we've mentioned quite a lot there with regards to how we can deal with a patient with anxiety. Now what I would like is for one of you to attempt an answer. So you should be able to see the notes here. I just want you guys, I'll give you like 5 minutes and you can try and answer this question. It'll be really good practice for you because dental anxiety is quite a big topic. It's quite a hot topic. And it will be a good like opportunity for you to test it, and I can give you like some feedback and tell you what things you did well or what things you did badly. So if you want to answer that, put a yes in the chat or say something in the chat or just unmute, whatever you'd want to do. You don't have to turn your camera on if you don't want to, but I'll give you guys a couple minutes to do that if you want. Again, this is just as I said, this is just a good opportunity to practice questions. Like the more practice you do, the better. So there's no point, like if you feel a bit nervous, don't worry about it too much. It's not that serious. It's more of a chill session today. So I'll give you a second. Does anyone want to answer it? Again, guys, I'll tell you something. Look, so your interviews are coming up in like a month and a bit, right? These types of questions are going to come up. You're going to be struggling with them in the real thing. So doing practice now is the best way for you to be prepared for the real thing. So don't, again, if you are feeling like you kind of want to answer it, but you're a bit scared, just answer it. This is like the most chill session you're going to have. And this is basically free interview prep. So it's actually to your absolute benefit to try and answer this question. But it's up to you. Brilliant. Thank you very much, Alex. Cool. All right, Alex. So the question is, as you can see, all I need you to do is to unmute. If you want to show the camera, turn your camera on, you can as well. Up to you. I don't mind. The question is, a patient with severe anxiety comes into your practice. Every time you approach them with a drill, they panic and refuse to open their mouth. How would you manage this patient? So whenever you're ready, you can begin.
I think one of the most important things in this scenario is obviously to find out the cause of the patient's anxiety. So that could potentially be a past experience that they had as a child, or maybe some influence that they had from a parent. And I think that's something that's really important to find out as the dental practitioner, because then that means that you can try and adapt your approach during this session in order to make sure that that anxiety does not happen again, and to try and avoid that in future appointments, and reassure the patient that that is something that won't happen again, that that could have been something unique to that past experience that they'd have. The fact that they won't open their mouth suggests that they are maybe unaware of the importance of this treatment. So, for example, if I don't know what exactly the treatment is, but if it was something such as dental decay, and they might not understand quite how important it is to treat that. For example, the disease progression process. And they might not understand that if we don't catch the disease and prevent it in the early phases, that that can actually be something that can progress, and that could have impacts on much wider. So it could have impacts on their general health, or their ability to socialize, meet other people, go out for meals, and just their general confidence. So I think a really important thing to do in this situation is to educate the patient of why they need to open their mouth and take the treatment, but also do that in a calm and reassuring way, so that, again, to prevent them feeling forced into anything that could, again, make them more reluctant to visit a dental practice in the future. And again, I think by explaining the process of the treatment, so by doing the tell, show, do technique, I think that that's something that would really help the patient overcome their anxieties, by ensuring that they know what the equipment is, how it's going to be used, any noises, sounds to expect, so that they don't feel like, oh my goodness, what was that? So they feel that they know exactly what's happening and when it's going to happen, and really emphasizing that, having their informed consent, I suppose, by like asking them each stage of the treatment, checking, is that all right for you? If you'd like me to stop, raise your hand or something, having that sort of pressure release for the patient. So if they want the appointment to stop, they can raise their hand or something, and you will know as a dental practitioner that they need a rest break. So to sum up, I think that it's really important to ensure the patient knows what's happening, when it's happening, why it's so important that they get the treatment on that day, preferably, and how to mitigate these feelings in the future.
Okay, anything else you'd like to add?
No, I think I'm done, thank you.
Okay, so I'll ask you a follow-up. So what if after all this, the patient is still very nervous, and you can tell that, you know, nothing's really going to progress much further? You try and rebook a session and they're still feeling really scared. What alternatives can you do? What can you provide as a final solution for this problem?
I think that if the patient has a severe anxiety, that is something that won't be able to be overcome through talking the treatment through and trying to find out what the cause is. Referral to maybe a community centre where there's people who are specialised to deal with patients who have extreme phobias, and that they have different techniques that they can use that maybe I'm not going to be trained in as well. So by providing them that alternative option, they feel as though less pressured during the appointment that they're in with me, and therefore that might help to reduce their anxieties a little bit more.
Okay, thank you. Cool, so there you go, nice and easy, perfect. That wasn't too difficult. So you guys can see here, this is how I kind of like take my notes for these types of questions, how I jot down what the interviewee has said. One of the things that I really liked was that you mentioned tell, show, do. Again, I keep saying that this is just a really good and easy thing that you can mention in your anxiety questions. So really do make sure that you do that. And as you saw at the end, I saw that Alex had finished a little bit early, which is good. It's not a bad thing. And I asked her a follow-up question. You have to bear in mind that in your interviews, this will happen. So if you finish early, they might ask you a follow-up, or what they might do is just ask you, is there anything else you want to add, and then just stay silent. So you have to be prepared for any type of question that can be related to the like initial question that's been asked. Now, before I go into like some tips, what did you guys like about the answer? What do you guys think that Alex could improve in this answer? You can either unmute or you can write in the chat.
I like the structure of her answer. Like she started off by talking about the patient experiences and then giving solutions, and also linked back to the GDC. But she could have like talked about getting the nurse involved to calm the patient down. And yeah, that was about it.
Good. Anyone else have any tips? Any good things or bad things that you liked about the question or the answer even? Oh, let me see who's this one's getting admitted. Cool. So yeah, I think I'd agree with that statement. I did think that your structure was quite good. I liked how you worked through it. You took time with it. You went from, talking about the fear that the patient might have with regards to opening their mouth and the fact they might be unaware of the importance of the treatment. Very good. One thing I'd say is, I just say this to everyone, I just don't like when people say dental decay. Dental decay is more like a colloquial, or like it's more of a term used to explain to patients the term of dental caries, because it's just easier to explain what decay is compared to caries, but just say dental caries potentially. I just prefer that. It's not the biggest thing in the world, but it's just makes you sound a bit better. It's good to catch the disease in the early phases. Good. I liked how you mentioned it can impact their social health, general health, and confidence. I really like that. Not a lot of people talk about the impacts it can have outside of just their physical health. So that was a really interesting point to mention. Educate the patient on why treatment is important. Very good, because a lot of people also forget just teaching the patient. Like, you don't assume that the patient's stupid. You have to assume that the patient has some understanding of what they're going through. So it's always very good to go into depth and explain to them what's happening. That's how you gain your informed consent. And on top of that, educate them on the task at hand. Next, gaining informed consent. I liked how you mentioned utilizing non-verbal communication, so raising their hand when they want to stop the procedure. Summary, very important to know and ensure the patient knows what is happening, how to mitigate feelings and get treatment. If they're still anxious at the end, you might need some serious help, refer them to like community center, help deal with more extreme phobias. I think the reason why I asked that as well, okay, do you mind if I read this question out loud, Sunil? Because you've asked me this like privately, so do you mind, or I'll wait till you answer that. So when it comes to, just back to what I was saying. So with the severe anxiety, the reason why I asked that is because it's important to understand that it's not a dentist's role to treat depression and treat anxiety. We're not trained for that. You have to be able to identify if a person is like come across as very anxious and might need some extra help. That is part of your job. Like, that's what you have to be able to do. But it's very, very important to understand that it's not our job to like treat severe anxiety. We're not trained to do that. So yeah, it was really good that you showed the skill, and you said you'd refer to a community center. One thing I'd say though is that it would be good to like talk about some easier things, like some things that you could do in the practice. So playing some music would be a good thing, getting a family member involved, getting the nurse involved. But apart from that, I think the answer was pretty good. I did like the answer quite a bit. And I liked how you mentioned that non-verbal communication and like the raising hand and stuff. One thing I'd also say, this is like a really basic thing, is just say, if every time you approach them with the drill, the first thing you do is stop the drill, wouldn't you? Like, just be very obvious, make it clear to the interviewer, like, the first thing I'm going to do is stop treatment. You'd stop everything that you're doing, and then you'd do everything you did. That's the only thing I probably would have said to add on to the answer. But apart from that, very well answered. If I have to give that like a mark out of 10, what I normally do is I'd say, in terms of like the content, I'd probably give it like a 4 out of 5 for content. So content, my God, content, 4 out of 5. Communication, I'd probably give that like a 4.5 out of 5. That was, a very good answer, to be honest. You spoke quite well. You had very good pacing. There wasn't much ums and ahs that I took note of. So yeah, cool. Does that all make sense to everybody? Anyone have any questions about that? Anyone want to have a bit more information about that side of question, or does that make sense?
I don't get the referral to community center.
Yeah. So I'm not too sure about community center specifically, but mentioning like referral to a special care center for dentistry is fine. You can mention that, or to like a psychiatrist, or for like just even making a GP aware, like even referring to the GP and making them aware that, okay, this patient is presenting with severe anxiety. That's something that you can do as a dentist. So maybe don't say community center, but you can say those other things. But the reason why I kind of let this one slide is because it showed that she has an understanding that that has to be referral outside of the dental practice. So yeah, but yeah, I see your point. You maybe don't say community center specifically, but you can say that you'd refer to somewhere else for some special care for this specific patient. Any other questions regarding to that, guys, or should I go to the next question?
Could you talk more about CBT, please? Or
okay,
yeah,
okay. I'm gonna say one thing. Don't worry too much about CBT. All I want you to be able to do with CBT is understand that it can be used as a treatment for anxiety or depression. That's all I think you need to know. This in the interview, that shouldn't be something that you delve into too much detail in. If you want to read up more, I'd say read up some articles on CBT online, or I think the NHS actually has like a page talking about CBT and how it's used, so you can check that out as well if you want to find out more. But don't stress too much about it, okay? Just thought I'd let you know that. Calm. Any other questions, guys?
This isn't relevant to this, but
Okay.
do you need to know about like euthanasia, like have your own opinion on?
No. That's more for medical interviews. You wouldn't really be asked that for dentistry.
By the way, you know when you're given a scenario like this,
yeah,
do you talk in third person or do you answer it from the dentist's point of view?
No, you talk. Oh, okay. I see what you mean. You could say, as a dentist, I would do this, and then talk like that. So, as a dentist, I would do this. I would tell I'd stop the treatment, and then yeah, it's up to you really. But don't do it as a role play. So in a role play, you say, "Oh, hello, how are you today?" Like you actually talk as if it's a conversation. This is different. So yeah, just make sure that you're kind of referring to it in that manner. Cool. Okay. One more question on that, and then I will move on to question 2. Any questions that anyone has? If you have a question, just type it on the chat and I'll look at it. Anyway, so next question is, this is a role play, by the way. So this is, you have told your friend that you would go to dinner with them at Hakkasan, but you've been called for an emergency appointment 5 minutes before you need to leave and have to cancel. Break the news. So guys, what do you think are some things that you need to consider here? What is a really key thing here? Yep, apologizing. Good. What else?
Maybe building up to what you have to say instead of straight out saying that,
Good.
oh, I can't come with you to dinner.
Nice. Thank you for saying that, because so many people think straight away what they do is, oh, hi, how are you doing? Oh, sorry, I have to cancel. So you have to think of this as if it's actually your mate. If you're going out with your mate and you've cancelled on them, you don't want to just say it straight away. You'll be like, oh, how are you doing? You're all right. Talk a bit, and you'll be like, oh, by the way, I'm really sorry, but I can't go out tonight because of this, this, and this. Yep. And then Disha says, be honest about why you can't make it. Good. Yep. Honesty is good. You shouldn't lie and say, oh, I've got like a family emergency. Just be honest and say, by the way, I just can't come because I've been called in for work. So that's good. What else do you think we need to mention, guys? Explain the situation.
So rescheduling.
Good. Yes. Lovely. So what solutions do you think you can have while you're here? What solutions could you do?
So organising a time when you're both free to have this dinner at a later date.
Good. What else could you potentially do? Let's say you know for a fact that you're booked up for the next like 5 weeks. What could you do instead?
You could explain to them the importance of this appointment, like why you have to attend it.
Yeah. Good.
So they understand like why you're leaving and cancelling on them.
Good. Yeah, because bear in mind, imagine like you get told something like, oh, by the way, I have to go into work. And that person's not sure. So wait, why wouldn't you know this before? Like, surely you would have planned this appointment. So making it clear to them the gravity of the situation, explaining that this is a dental emergency. I really need to go in and I don't really have a say about it. So yep, that's correct. So explain the importance of procedure. Good. Find a solution. Good. Book another date. Lovely. What other things do you think you can do here? Or what skill do you think is really? What skill do you think they're assessing in this question? That's another question. What are the two main skills do you think they're assessing?
Your problem-solving skills.
Yep, problem solving. Good. And what else?
Is it empathy, understanding
There
like
you
how
go.
you're.
Good. Yes, empathy. 100%. So what is empathy? Whoever said that, what is empathy?
Is it understanding somebody else's perspective on things?
Okay.
Putting yourself in their shoes.
Yeah. And how is that different from sympathy?
Sympathy is like knowing their like feelings, but like, empathy is actually like putting yourself in their shoes. It's just being aware.
Cool. Yeah. Okay. Now I'm going to ask you guys another question. Let's say you have a patient that comes in and they have cancer and you need to show empathy. How can you show empathy to someone if you've not had the same experiences that they've had? There you go. So if you have a cancer patient, you can't, and you haven't had cancer, or maybe you haven't had someone in your family that's had cancer, how can you show empathy? How are you going to put yourself in the shoes of someone that you've never had a similar experience to? There you go. That's a good question for you.
It's like the same thing if someone told you you had cancer. You know what I mean?
What do you mean by that?
Of course, if you've never gone through that situation,
Yeah.
just think of it when someone tells you that you have cancer. How would you feel if you're not saying?
So like looking at their perspective, basically. Yep, that's good. What other thing could you do? So if you're okay, that's good. That's a good start. So if we're looking at their perspective, what things are we thinking about? What are we going to be considering? There we go. Understand their emotions. Yep. Sorry, go on. Whoever said that earlier.
How the patient's feeling.
Good. Yeah, that's what I was going to say. So you may not have had the exact same experience, but you will be able to, like, as a regular normal human being, you'll understand that they have certain emotions. They're going to be frustrated, angry, confused, upset, and we've all experienced those types of emotions before in our life, correct? So what you're going to try and do is try and understand their perspective, but also be aware that you can't say, "Oh, I understand what you're going through," because you don't understand what they're going through. Like, that's one thing I'd say is a big no-no. Never say, if you're in a situation where you actually don't know what the person's going through, don't attempt to do so. That doesn't show empathy. That's actually, like, it's a bit rude. Instead, you can say, "I can't begin to imagine how much pain you're going through. However, I can understand that there must be a lot of upset thoughts and upset feelings that you're having right now. It's a very confusing time, etc." Do you see how instead of me focusing on, "Oh, I understand that cancer is a really upsetting thing," I'm going into the idea of their emotions more. So I understand how upset you must be, how frustrating this must be, how scared you must be. You know what I mean? So I'm focusing on a different element of this. I know this is not as serious of a situation because you've probably been cancelled on before, so it'll be easy to empathize because you'll know that person just like angry with you. But I'm just trying to tell you, like, try and extrapolate this type of thinking onto a more difficult question where you might be told a really weird and difficult and like hyper specific complex scenario that you've never had before, and show it empathy. So yeah, cool. Any other things you guys think you need to mention in this question? No? Yeah, I'd probably agree. I think that's most of the things mentioned there. I think the last thing is just watching your tone. So watching the way that you speak. Obviously, if you are in the wrong here because you've cancelled on them, so ensuring that you're taking things a bit slow, you give them time to process the news. Make sure that if they are angry, you don't get angry back. Like, I know you probably won't do that, but just be aware of it because you might have an actor that gets really, really angry and frustrated with you and like tries and makes it like really immersive, and you just have to stay calm and collected. And the next thing is understand that sometimes silence is good, or sometimes not replying is good. So you're going to have situations, especially with role plays, where the person's just talking at you and you might be feeling that they're rambling on for a long time. If that's the case, it's fine. Just let them speak, let them rant, let them take it all out, and then try and introduce yourself in the middle or like near the end, because it's just not a good idea for you to interrupt their flow, because they might be trying to get everything off their chest before they let you say what you want to say. So that's one thing I'd say. Just make sure that you allow them to express their opinion and their feelings. Cool. Okay. So who wants to do this role play?
Can I ask something real quick?
Yes, go ahead.
Would the interviewer observe how your facial expressions are?
Yes, they would. 100%.
Okay.
Because if you let's say you see like you have this situation and they say something and you don't agree and you say like, you do like a face like that, like, you're confused. They're obviously going to interpret that as a piece of that's non-verbal communication. So that they will look at that. Things like nodding as well as non-verbal communication, like eye contact, they'll be assessing that. the way that you're sort of acting. So if you're kind of like laid back and like, you know, more relaxed, they're going to interpret that as you not really caring that much. If you're more attentive and sitting upright, they're going to take that as you being more engaged. And bear in mind, because it's COVID this year, you need to really have that non-verbal communication on lock. Because it's harder to read the room, because when you're in a real interview, you're in a room with another person, or you're like in a MMI station, and they have a greater ability to identify your skills and identify your non-verbal communication. But online, it's a bit more critical because you're just in this little box. So yeah, just make sure that you do have good non-verbal, and yes, they will definitely look at your facial expression and look at your eye contact, etc. Cool. So I know a lot of you wanted to do role plays, and like I had a few DMs asking me to do role plays for like a YouTube video. So this is an amazing opportunity for you to practice one. This one's quite an easy one compared to quite a the other ones that you might get. So if you want to try and practice this one, put your name in the chat and we will go through it now. I'll be the actor, so I'll be the friend that you've cancelled on, and you will be the person that needs to like break the news to me. So if you want to do that, I'll give you some time to put your name in the chat. Again, I'm going to give a little talk again. This is just really good practice for you guys to do for your real interviews. It's basically free interview practice. So, you know, do it. It's going to help you. If you do great, perfect. If you don't do that great, who cares? No one's going to see like anyway, because your cameras are off, so it's not that deep. I can. Cool. Lovely. Okay. So, Shard, right? Is that how I say your name?
Yeah.
Shard. Okay, perfect. So, I'll read the question out to you. I'll set a 5-minute timer. And whenever you're ready, you can begin. But I'll tell you. So, firstly, you have told your friend that you would go to dinner with them at Hakkasan, but you've been called in for an emergency appointment 5 minutes before you need to leave and have to cancel. Break the news. I'll read it one more time. You have told your friend that you would go to dinner with them at Hakkasan, but you've been called in for an emergency appointment 5 minutes before you need to leave and have to cancel. Break the news. So whenever you're ready, you can begin. Bear in mind it's a role play, so yeah.
Hi Faris, how are you?
Hi, I'm good, thank you.
How's your week been? Are you all right?
Yeah, I'm fine. You know, nothing much. Just really been looking forward to tonight. Like, I really wanted to go to have dinner for like this last week, so really looking forward to that.
I know we've planned it for quite some time now, so I've been looking forward to it as well. But I've actually come here to speak to you about that.
Okay.
I've just been busy with work, and I've had a certain emergency appointment which has interfered with our plans. So unfortunately, as a result, I can't make tonight. I'm really sorry about that, and I apologise, but it's really important. It's an emergency situation, and I've been called in to work in order to deal with that.
Okay, but I asked you this, and you said you definitely don't have work. Like, that's why we picked tonight. You said you definitely don't have work today, so I don't understand like why you need to go in. Like, what do you mean you have to go in?
Yeah, I apologise, and I understand why you're saying that, and I did say that I could make tonight, but it's just the nature with my work that at times we can be called in for emergency appointments, which is unpredictable, and for that I apologise, but hopefully we can reschedule for another time when definitely I am able to meet you, maybe during my holiday or during a time where we both can.
But how do I know that you're going to be able to meet me when you've done this already, and you said you're going to see me definitely today, and now you've cancelled on the day? So how can I make sure that you're definitely going to be able to see me? I don't understand.
Hopefully I've got my holiday coming up in 2 weeks' time, and we're not called in during that time period. So I can definitely confirm that I won't be called in for work, and hopefully that will mean that our plans will be uninterrupted. But again, I apologise, and this is not something I foresaw. But hopefully you understand that, and I'd appreciate it if we could come to a solution for the future.
Okay. I'm not too happy about it, but I guess yeah, we could book it in for like your holidays. Do you know when you're going to be free?
Yeah, so I have my holidays in 2 weeks' time for a 2-week period. So if you're free during that time, we can come to a date where we can have dinner together.
Okay, cool. All right, thank you very much. Cool. I'll see you in 2 weeks' time. All right.
Okay, thanks for understanding. See you.
Bye. Cool. All right, cool. Guys, back to it. What did you like? What didn't you like? What do you think we can improve? What do you think went well? You can unmute and say, or you can.
I liked how she kept apologizing. Like,
okay. Yeah.
And it just softens the blow a bit.
Cool. Any?
And she throughout the whole thing, like she didn't really lose her temper.
That's true. Stayed calm. I will actually disagree with the apologizing. I was going to say the opposite. I was going to say you kind of apologize too much. Like I was kind of feel like I get your I get you apologize. Like stop. You don't need to keep saying it. But that's an example of how people can interpret things differently. Like one into you might like it, one might not. But I would, to be honest, I'd say it was a little bit too much apologize. It's like I'm sorry. Oh, I really have to apologize, etc. Next thing I'd say is I don't think you read the situation super well. You're talking to a friend, and you were talking very formally, like super formally. You're like, oh, I really want to apologize. We'll try and reschedule for this. Like, you can be more. I'm not saying speak in slang, but you have to understand that. It was like you were speaking to a patient, or like you have to understand that you need to look at the situation first and then make a decision. And there's a specific reason why I use this. Is because this is like, and bear in mind, don't worry at all. This is like really common. A lot of people do this, but a lot of people, they do a lot of practice scenarios which are patient related, and then they think, oh, I need to just use that sort of template for every role play. And you can't, because in this one I'd actually penalize you for it, because I'd say, well, I felt that was so formal. Like if my friend talked to me like that, I'd just start laughing. In terms of like, I'm not saying as in it was bad, but as in like I'd feel like, come on guys, it's not that serious. So I just want you to be more chill, relax. You know, you can be more relaxed with me, like just talk as if you're a friend, because that is the whole point of the situation, is to understand that, well, I know that I've done something wrong, but at the same time, I'm not going to talk to my friend like they're a patient. I need to talk to them like they're my friend. Because you might be given another scenario where it's like talk to your neighbor, or you might be given another scenario where it's like talk to an older person that's hard of hearing, or it might be another scenario, talk to a child. Like you wouldn't talk to a child and an old person that's hard of hearing in the same way. So in the same thing, you wouldn't talk to a patient in the same way you talk to a friend. So that's that. But in terms of the solution, yep, I thought the solution was good. Now, this is one thing I'd say that you did really well, was that a lot of people get really worked up about how to say a solution, because they're like, well, what if they tell me I can't do that? Well, you create the solution. You're creating the rest of the scenario, so you can say whatever you want in terms of the solution. You can say, oh, I've got a holiday next week, or you can say, oh, actually tomorrow I'm off, or you can make up the solution as you like. That's one of the beauties of the role play, is that you kind of guide the scenario. The last thing I would say is, like, and this one's I wouldn't penalize you for this, but I'm just saying, like, this is one thing I would do, is because you know that you did something wrong, maybe like offer something. So you'd say, oh, you know what, I'll treat you for the meal as well, because you know that you've done something wrong. So it'd be nice to show that person that, yeah, I this was bad on me, and I'm going to do this. So that's the only thing I'd probably add in terms of that. Does anyone else have anything they want to
add? She kind of talked about like the urgency of the appointment a bit more, like why she had.
Maybe. I'll be honest, I think that was okay. I think you did go into, like, she went into enough detail about, like, oh, it's an emergency appointment, she has to go in. So I think that was okay. But yeah, you could have maybe, if you wanted to, if you want to in your answer, you could specify the importance a bit more, because some people may not be super aware of the urgency of doing like an emergency appointment, because they might just think, oh, well, why don't you just get someone else to cover your shift? So, yep. I'd agree with that. So I'd say in terms of communication, I did think you were very well spoken. I'll be honest with you, very, very well spoken. But I'd have to knock you down just because it was too formal, in my opinion. So I feel like you misread the situation slightly. And in terms of the content, I think the content was fine. Actually, I think the content was better than this. I think I'd give that a 4 out of 5. I think you did quite well with that. I just feel like, as I said, the apologies were quite a lot. So you kept apologizing a lot. So I felt, it's okay. You made a mistake, but this type of stuff happens. But yeah, does that all make sense, Shard?
Yeah, thank you.
Perfect, no worries. But yeah, overall, I think that was a good answer. So yeah, all right, brilliant. Any questions you guys have about role plays, or anything about that question specifically that you'd like me to go over in a bit more detail before I move on to that last question?
Do you know, like, in role plays, when it involves like bringing past information in, are you allowed to bring it in, or can you only use information that they've like given you, like the role player?
What do you mean bringing past information in?
So it's like, I remember one time I was doing one, and it was like something like, oh, it's like tennis competition coming up. Yeah, one of the star players doesn't want to go training, and I said something like, in the last, like, you came last week, and the person after was like, oh, you can't bring information in unless you know it. Is that true?
Okay, I see what you're talking about.
It was just a university student, so it wasn't like
I would, yeah, I'd say if you can just stick to things that are going to happen, because you don't like, they're things that you don't know, so you can create that scenario. I personally wouldn't be too bothered if you mentioned something from the past, like, oh, like, for example, if Charlotte says something like, oh, I know I've cancelled on you in the past, I actually wouldn't mind that because it relates to the situation. But yeah, I do see what that interview, or like that student was saying. They're kind of just saying you might be, the way you said that might just alter the way you answer the question, so it might be a bit risky. But I don't think it's too much of a big deal. But I don't think there's many scenarios where you talk about the past anyway. A lot of the time you talk about what's happening in the present, or what plans you're going to make for the future. Like if you have a patient, oh, we're going to do this treatment for you in the future. Or if you have a patient in the practice, this is the treatment we're going to do today. You see what I mean? But yeah. Sorry if it doesn't answer it specifically, but it's because that type of question is very highly dependent on how the interviewer interprets it. Some interviewers might think it's unique because it shows, oh, he's kind of thinking outside the box and bringing in different values. Another might say, why is he trying to create a scenario when we've given him a scenario? So I'd say just stick to talk about things in the future, or the things that you're going to do in the present, if you can, just in case. So yeah.
Yeah, calm, thanks.
No worries. Any other questions, guys? With regards to like role plays and stuff like that? Or should I move on to the last one? Perfect. Okay, so last question is, how has COVID-19 impacted you? Now, this I think is a very good question, because no one really knows what questions they're going to ask about COVID this year. The ones that I did, I put one up on my channel, which was about like, how has COVID impacted dentistry? But that one's specific to dentistry only. What things do you think you need to mention for this question?
Like how you've been productive over lockdown?
Yep, good. How you've been productive. So what you've done during lockdown, exactly. Someone said resilience, good. What else?
As students, it's affected our education in some way or another.
Yes, good. Effect on education, student. What else?
Our normal day-to-day life.
Oh, sorry. Say that again. Sorry. Normal day-to-day life.
Yeah.
Yep. And someone else was about to speak as well. What were you going to say?
Family relationships with your friends.
Relationships, friends. What else, guys? What else do you think you could mention here?
Can we mention like the appointments being cancelled?
Good, nice. So do you mean you can mention so like dental appointments being cancelled? That's good.
Yeah, because I've got braces, so can you mention them? Like,
yes,
you know, because you
very good. Yeah, you can do that. And really quickly, because I know someone's going to say, well, what if I haven't had anything to do with appointments in this time? That's also fine. But you always have to remember this. Whenever they're asking you a question, always remember the first thing you want to do is answer whatever the question's saying, so like in a general sense. So this one's impacted you, so you talk about your personal experiences, but you do always have to relate back to dentistry. So one way you could do that is, as I think Fatima said, relate to her braces and how she couldn't do appointments, and then talk about how like appointments have been affected in dent. Or you can just talk about other things, like just mention things in dentistry that you know have been affected in general. You could do that as well. And yep, Bijoy said mental and physical health. Perfect. That's also a very good thing to mention. What else, guys? Let's try and think of a couple more things. There's so much you can talk about with this, because this question is good because it's quite open-ended. It just says, how has it impacted you? So there's so many things you can talk about. There might be some specifics you can talk about, sorry, in terms of like your own life, or there might be some more general things that you're thinking about, like in terms of how it's, there you go, good, new hobbies. Yep. So this kind of goes under the productive in lockdown. So yeah, put in brackets, new hobbies. That's very good. Skills you develop. Sorry, who said job?
I'm sorry. If you had a job, or if you volunteered previously,
nice.
You weren't able to do that. So, what alternatives did you do?
Nice. Yes, there you go. Perfect. That's what I was looking for. So alternatives. So obviously a lot of you, and I'm sure there's some of you that didn't get work experience because of COVID or had their work experience cancelled. So that's something you can talk about, and you can talk about how it impacted you as a dental student. And that's where you can then bring in your skills. So Disha said, mention your skills. So how can you talk about that? You can say, well, for example, I had my work experience booked in for July the 5th. Unfortunately, due to the COVID-19 pandemic, I wasn't able to attend this work experience, which really made me lose out on a lot of hands-on dentistry and see it firsthand. So instead what I did was I went online, and I went on like an online virtual work experience, or I DM like a dentist or whatever, because that shows, number one, it shows your resilience that you got through like a difficult time, and it also shows that you have initiative. So through talking about your experiences, you're indicating to the interviewer that you possess certain skills. And even though this isn't a skills-based question, but you can make it a skills-based question if you're smart in the way that you answer the question. Someone mentioned time management. Yes, I agree with that a lot. Time management is a massive thing. And you can talk about how time management is important in the dental practice as well, because obviously you're always seeing patients, you always have to adapt your time. And social distancing and masks. Yep, nice. That's a good one as well. Just talking about how life has changed. Like, even if you give like a general thing, like having to adapt to wearing a mask when you're going out, or like in indoor spaces, having to adapt to social distancing when you're like in a public area or at schools, etc. That's something very good you can talk about. And let's try and think of one more thing. What's one more thing you think you can talk about? As I said, this is like just scratching the surface, but yeah, go ahead, sorry.
Can you, like, for me, like, I realized I wanted to do dentistry over that lockdown. Like, that's when I decided I wanted to do it.
Okay.
So I guess you could talk about you have more time to reflect on things.
Yep.
Because you're not really in school or in education.
Good. You can talk about that. Yeah, and it's always good to talk about self-reflection. I think self-reflection is not even just in terms of the interview sense, but in terms of real life, is something that's very helpful and can help you like achieve a lot of goals in your life. So talking about self-reflection is good. Racism. Okay, okay. Okay, when it comes to something in terms of like anything to do politically or anything to do with like social issues, I'd kind of avoid those when you're interviews, because you can kind of open up a, what is it, like can of worms that you can't, or like open Pandora's box that you can't close. So I'd avoid that. If it is something that you did experience, of course, I'm not detracting from the value of that experience or the value of that movement, but just I'd say avoid that in your interview, because you don't want to open up something that is quite hard to go into, because racism is quite a complex issue to delve into in a like a 5-minute answer if you think about it. Cool. Okay, I think that's good. There's definitely more things you can talk about, 100%. But just kind of building up on that racism point, don't talk about like anything political. That's one other thing I'd say. Don't talk about, oh, I'm anti-mask or I'm anti-vax or whatever. Like, I don't know if you are. I don't care. You can have your opinion. But don't mention like those values in your interview, because that's not what they're looking for. They're not looking for like your opinion on political things or on things that are like a bit odd. They're looking for your opinion on this answer. They're looking for how you talk about your impacts and how it's impacted you and how it impacted dentistry. So that's the last thing I'd say, relate to dentistry. This is something that you should always do. Even if it doesn't say in the question, you always relate to dentistry, because at the end of the day, they're only asking this question to see if you're going to be a good candidate for the dental school and if you're going to be a good candidate to be a dentist for like, what is it, 30, 40 years of your life? Imagine that. 30, 40 years just looking at teeth. But you know, that's what we're doing. Cool. All right. If anyone wants to answer this, again, put your name in the chat, put a yes, do whatever you'd like. I'm not too bothered. This one's a really good one to practice as well, because as I said, it's not really been asked before in an interview, so in terms of like in the past, because COVID's only happened this year. So this will be a really good opportunity for you to just practice these types of skills and practice going over a question related to something brand new, especially because with COVID as well, there's another element that you can look at. You can look at how it's impacted you, and you can also understand like the scientific side of it, so how it's transmitted, the impact of the vaccine, the impact of testing, etc. That would be something else that you could explore in a COVID question. So yeah, I'll give another few minutes, not a minute, I'll give like a couple seconds for you guys to for you guys to volunteer. If you don't, I'm just going to pick someone out, and we can do it like that. So give you a couple seconds. Okay, no worries. So who am I going to pick out today? Mark, do you mind trying to answer this question?
Yeah, that's fine.
Cool. I'll read it out to you, and just so I can get the timer set up. So the question is, how has COVID-19 impacted you? So whenever you're ready, you can begin.
Okay, so I would say the first thing is that when lockdown started in March, one of the main impacts that COVID has had on my life is how I wasn't able to go to school due to the lockdown, and instead we were having online lessons. And one of the skills that this has helped me develop is resilience, because I would say one of the negatives of having online lessons is the fact that you're not able to interact as much with the teacher and with your classmates in a classroom virtually. And it also helped me to develop resilience, because it meant that I had to stay in my room most of the time to do the work that was set, and at the same time attend the online classes. And I believe that resilience is something that will also be useful and helpful to me as a dental student, because I do understand that within the dental degree, there's a lot of workload, especially during year one. where dental students are faced with a lot of new content that they are learning, and resilience is important in order to help you maintain motivation in studying this degree. I would also say that another way that COVID-19 has had an impact on me is that it has actually helped me develop my hobby, and that is playing the clarinet. And one of the things that actually it helped me improve by is that it helped me actually get involved with the school wind band orchestra. And this is something that I've always wanted to get involved with. And recently we were filming the Christmas concert virtually, where everyone was filming their part of the music piece, and our music teachers were collating it all in one video. And this is something that has also helped me develop my manual dexterity skills. And I understand that this is, again, something that dentists must have as they work in such a small area, and they have to be quite meticulous with how they work with their hands creatively. Although these are some positive things I've developed, I would say one way that COVID-19 has impacted me negatively is the fact that after actually returning to school, unfortunately, I did feel that I had symptoms, and I got tested and the result was positive. And I would say this was slightly negative because it meant that I was no longer able to get engaged with online lessons, but although everyone else was returning to schools, I had to self-isolate for 14 days. And I guess this was quite negative because it meant that I wasn't able to get the same quality of teaching that my other peers were having. And one other final negative thing I would say is the fact that my regular 6 months checkup was cancelled. And I would say this is a negative mainly because I do value highly going to a dental checkup, because this is where the dentist is able to detect any early signs of either things like dental caries or any other oral diseases, but at the same time give me valuable advice regarding my diet and how I can prevent any other diseases from progressing if there are early signs.
Okay, anything else you'd like to add on to this answer?
No, that's it. Thank you.
Thank you. Okay, cool. Again, open up to the floor. What did you guys think was good? What did you think was bad?
I like how he went into his points into detail. He didn't just list a series of points, but explained them. One thing it might be a minor point, would be I'd start with the negatives and end on a positive note. But I don't think it really matters. I just think finishing off with a positive tone might leave a better mark.
Cool. E said good to mention both pros and cons. I agree. Yep. Nice. What else? And I do appreciate that point about ending on a positive. Yeah, it's something that can be done. I think it's just a structural thing, so it helps you just structure things easier, especially when you just start with negatives and then you kind of end on the highs. Just a bit easy. It can just be easier for some people, but because of the way that you did structure it, I don't think it's too bad. But as a general rule, I'd agree with that point, because some people aren't that great at structuring when they're under pressure. So normally it's really easy to think of the bad things with COVID, because there's so many bad things that happen this year, and the positives come a bit later. So it just might make it easier if you're in like a high stress environment in your interview to start negative, get to positive. Cool. Anyone else? Any other points you guys would like to add? Oh, maybe good to add how he tried to. Yes. Yeah. That's true, actually. I agree with that. Maybe, yeah, I'd say maybe go into a little bit more detail in terms of like how you overcame some of your problems. But the thing is, you did mention how like you related to the skills, and then you related those skills to dentistry, which I really liked. And the way you did it didn't sound forced. A lot of people really fall into the trap of it sounds super rehearsed. Like, so I did this. I developed resilience. Resilience is good because the way you did it sounded a bit more natural. But yeah, maybe go into a little bit more detail about specifically how you overcame like the difficulties with online lessons, like saying, oh, instead I started making more extensive notes at home, or I changed my revision tactics, something like that. That could be really good. Because remember, I think you're kind of like E is sort of applying that value that I'm saying. Always give a solution to the problem you've given. Don't just state the problem, because if you didn't solve it, then what's the point? It's like stating a weakness and not talking about how you've tried to improve that weak or how you've worked upon that weakness. So yeah, that's one thing I'd probably say, and I agree with. Anyone else? Any other points you guys think you want to add to that? Nope. Good. Yeah, I just want to say though, I thought that was a very good answer. Like, I really like the way you structured it. I've asked this question to quite a few people, and it can be quite hard to make it sound unique, but you really brought in a lot of unique values. You didn't, and one really good thing about this, and you should take note of this, guys, is yeah, we did talk about quite a lot, but he didn't have to use the entire 5 minutes. He knew when to be concise and he knew when to cut off his points. He didn't have to ramble on too much. The issue with a lot of people is they feel like, okay, well, if I'm going to talk about developing my hobby, I need to talk about playing the clarinet. I need to talk about how, like, what grade I'm in, like music. I need to talk about how long I've been doing it, etc., etc. But in this case, he was really straight to the point. Clarinet, school orchestra, got it filmed, blah blah blah. Very good. So I'd build up on that. I'd say in terms of communication, I actually really enjoyed the communication. I'd give that like a near perfect. But yeah, in terms of the content, I think that is a good point. Like, if you can, try and give a bit more clarity on how you overcame some of those cons. But I'm not too upset with it because of the way that you went through the answer, and I really liked the relationships you made between dentistry and the troubles that you had in your own life in terms of COVID, and also that you evaluated. That's another thing, guys. The reason why it's so important to mention pros and cons is because with any question, you need to evaluate it from a neutral standpoint. So even if you hated COVID and it was the worst year of your life, there is always something positive that must have happened at some point, and it's always good to mention this to show the interviewer that you have like a level-headed approach to things, and you have like a neutral stance on different topics. So yeah, perfect. So that is the 3 questions I had planned done. If you guys want now, I will stop the recording. So give me a second. I'll tell you guys when it stopped.